I'm Dr. Anwar Alahabi.
We're not getting audio. We need to get audio. No audio.
Anwar Alahabi. My research about.
Anybody hear me?
Yes, yes, we hear you. Yes. Study on pituitary adenoma. This is study done. Aim and objective. It's study the surgical result done for the patient suffering from pituitary adenoma in the department of the neurosurgery at Al-Thawra Hospital, Sana'a, Republic of Yemen, from period of 1 of April 2008, 1 of May 2010. By same surgeon, Dr. Nasr Naqeeb. The objective for this study to evaluate the patient presented to our department with a sign and symptom of pituitary adenoma. Patient that referred to us to our department, and to classify to this patient according to the tumor size, functioning or non-functionally, to evaluate the type of the surgery, complete or partial resection of the to evaluate the surgery, complete or partial resection, and surgical approach to this tumor, to evaluate the surgical result of those patients. Material and method, including criteria for the patient. Patient with pituitary adenoma with pressure symptom and hormonal symptom, or both. Either. Okay, thank you. Pituitary tumor with epilepsy. Exclusive criteria: the unfit patient due to any systemic problem, either massive disease or anything, or frank infection, or any contraindication for the pituitary adenoma. Sinusitis, common cold, severe infection. Surgical approach, transphenoidal approach, used to the all patient as a first choice. Transcranial approach, done as a second stage procedure for the giant multi-compartment tumor. Introduction. Pituitary gland is a pea-sized endocrine gland that site of the base of the brain, often referred to us as a master gland. The pituitary gland synthesizes and releases various hormones that affected several organs throughout the body. At the Greece, we call the pituitary gland as the site of the soul. Hormone, it's component of the two-sided anterior hypophysis and posterior hypophysis. Hormone secreted by adenohypophysis or anterior hypophysis. The corticotrophy, it's controlled releasing hormone. It is starting from the hypothalamus the affected tissue. As corticotrophy releasing hormone releasing from the hypothalamus, affecting on the corticotrophic cells. Adrenergic corticotropin releasing from the pituitary, the origin adrenaline, the hormone cortisol, generalized the function is the generalized metabolism and for adaptation to stress. Thyrotrophy releasing hormone from the hypothalamus, thyrotroph, thyroid stimulating hormone to the thyroid to affecting T3 and T4, and this is control the metabolism. Gonadotrophin releasing hormone, gonadotrophin affecting follicular stimulating hormone, and luteinizing hormone affecting ovarian testes, estradiol and progesterone and testosterone. Sexual developmental in the male and female. Growth hormone releasing hormone from hypothalamus, somatotroph cell releasing growth hormone, liver and tissue, somatostatin, growth and glucose metabolism. Dopamine, leukotrophs, prolactin, breast and gonad, prolactin, lactation. Somatostatin, somatotroph, growth hormone, liver and tissue, somatostatin, and growth and puberty. Hormone secreted by neurohypophysis or posterior lobe of the pituitary. There is only two hormone, antidiuretic hormone and oxytocin. The hypothalamus, antidiuretic hormone, the posterior part of the neurohypophysis, just only to store the hormone that releasing by hypothalamus. Antidiuretic hormone, affection on the kidney, antidiuretic hormone, receptor for the water and kidney, reabsorption of the water in the kidney. Oxytocin produced by hypothalamus and stored on uterus, oxytocin and the uterus contraction during labor, and also affection during lactation. This is the gross anatomy. Thus we see. This is the anterior lobe, and this is the posterior lobe. This is the stalk. There is in this picture, there is very important structure that we see. This is the pituitary. This is the internal carotid. This is the eye oculomotor nerve, all the nerves that modulating the eye movement. Third, fourth, sixth, and fifth, and also the fifth, ophthalmic and maxillary, also beside or reporting to the pituitary hormone. This is very important view in this picture due to the sign and symptom that occur during due to secondary to the pituitary tumor. Observation and result. General sign and symptom. CSF amenorrhea, just only 7.7%. Headache, it's the most important sign and symptom signs for the patient. It's this study was with the headache and visual field disturbance by 8 out of 13 that represented approximately 85% from the study. Diplopia, 3 from 13 at 23%. Malaise, 6 out of 3, 46%. Depression, 6 of 13, 46%. And depression due to the patient when they know they have a tumor, patient, almost of them, they developed an anxiety and depression. Generalized weakness. Sign and symptom that can go with acromegaly, prognathism, just only 1. Carpal tunnel syndrome, 5 cases. Change of the hand and feet, 4. Hypertension, 1. Cardiac disease, 1. Sleep apnea, 4 from 3. And almost of them was acromegaly. Diabetes mellitus, just 2. Sign and symptom of Cushing disease mentioned by Dr. Hafdallah at the previous. Skin striae, 1. Obesity, 4. Diabetes mellitus, 2. Buffalo hump, thank you God, no. Mount phase, 3. Hypertension, 1. Amenorrhea, 5. Sign and symptom of prolactinoma, galactorrhea, 3. Diminished libido, 4. Infertility, 5. Testicular atrophy, 1. Impotence, 1. And amenorrhea, 5. And this is one important. We can say about the pituitary patient. We, as a neurosurgeon, we receive the pituitary tumor as a tertiary or secondary doctor, because almost of the patient will contact with gynae and obs, then to the endocrine, and then they coming with us. Almost of them, they coming to seek for infertility and for libido. Sex distribution. This is go, as we see, this is by the picture, it's dominantly 69% was female and 30% just only male. Market female predominance in this study, 69, male to female ratio is 1 to 2.3 in comparing to study in the University of Messina and Maizina. In Italy, that 1 to 2.7. And also, if you remember, Dr. Hafdallah, when they presented this lecture, also the same. It's a female predominance also. The age group, from the table, we can say the fertility group, it's the mean age group that's seeking for treatment at this age. From 20 to the 40, as we see in the table, from 20 to 35 as a second decade, third decade 4. The rest, all 9 cases out of 13. Just the rest only 4, 2 cases in from 40 to 50, and 1 case from 50 to 60, and 1 case from 60 to 70. This is the age group. Clinical presentation. Headache is the main sign and symptom for the study that appear on these cases. Headache is the most common presenting symptom, 48.6, in comparing to study done in the University of Messina, that only 58. Visual field disturbance. Most common case of the visual field disturbance, also 58.7 in the comparing to study done in Highland University College, is that only 47. If we review the anatomy, that's when we review almost of the nerve that passing beside or under the pituitary in that area. So the visual field disturbance is important. Ptosis due to the third nerve cranial palsy. To make you annoying to listening, doctor. Diplopia, epiploxy, amenorrhea. As we've seen, if you review the age group, almost of the cases from 20 to the 40, age of fertility and marriage and to conceive children. Amenorrhea is 38%. 38.5 was a cause of the sick medical advice to late discover the pituitary adenoma. That result was lower study done in the University of Medina that only 62. And also this is why they referring from they seeking also for gynae and endocrine before they seeking for us. Galactoria, that is 67.9 0.9, that's positive, and the negative only just 28. Galactoria was one complaint of the study by 23.10 and lower than the done in University of Messina and Messina, and Italy that 59.
Could you please go to the conclusion, Dr. Anwar?
Time off. Okay, dimensional libido, impotence, also depression. Depression malaise, it's most important in this study. Hypertension and diabetes mellitus, cardiac problem also. The conclusion, Doctor, we should educate 9 cases of the of abnormal. Conclusion, Doctor, almost of the cases, and still a lot of, in almost of the cases dealing with neurosurgery of pituitary as a tertiary surgery. They didn't come as first. They contacting first with gynae and obs. We should learn or educate the people about the hormonal disturbance. Maybe it's from centrally, also for our college of the doctor. Thank you. That's so long. No question?
Anwar, for this fulfill and informative lecture, we will open the session for discussion. Dr. Ahmed.
How you assess impotence and decrease in libido in our community?
Yes, as I say at the first point, almost of the study was female, and they contacting with gynae doctor before they coming for us. The main problem telling us by gynecology and obstetric doctor for us, patient seeking for medical advice due to amenorrhea or due to the galactoria, and there is no or infertility.
This for infertility, but impotence and
patient, yes. When they contacting also, I say as we are secondary, they contacting before us either gynae and obs or either the Euro doctor. They tell us it is we're referring for you because patient was infertile or impotence or anything. And it's